February 4 marked World Cancer Day, and the month of February is National Cancer Prevention Month. And there are about 12.7 million cancer cases globally every year, and this number is expected to increase to 26 million by 2030.
As part of its cancer awareness and prevention efforts, non-governmental organizations are carrying out sensitization and awareness campaigns to educate the Nigerian populace on the preventive measures and, of course, what cancer is all about.
Well, joining us now is Eniola Akintunde, founder and executive director, Niola Cancer Care Foundation, as well as Olatunji Ola-Davies program coordinator. They will both be speaking on the National Cancer Prevention Month, especially from Nigeria's perspective. Thank you for joining us this morning on the show.
Yeah, thank you. Good morning. Thank you.
You know, cancer, despite being one of the leading causes of death globally, I mean, it seems as if awareness is still minimal in Nigeria, and there's a lot of misconceptions. What are some of the most prevailing misconceptions you have come across, and how do we fight this ignorance? Let me start with you.
Well, thank you very much. Once again, it's a pleasure to be here. You know, every 4th of February, Cancer Day is marked all over the world. And the theme for this year specifically is I am and I will. Is a statement of commitment for an individual that we can mobilize all stakeholders and government, you understand, to do the needful as expected, you know, in the area of preventive cancer. Most importantly, education is very paramount and information is key. You know, like you have said at the beginning, cancer globally is the second leading cause of death all over the world after cardiovascular issue. And you can see that countries are classified into 3 categories. You have the high income, the middle income, and the low income. Of course, currently it is stated that the middle income, you know, has moved away from that category, which means the high income environment, you understand, they are most affected, despite the fact that they have the information, education, and facilities. But what we're saying is that it's cause for concern because the rate of death is becoming astronomical, and the truth of the matter at the level of government in Nigeria, you know, government is just trying to do the little bit they are doing. But I think there's need for an engagement with all stakeholders, you know, those who are involved in cancer-related issues, to educate, inform, dialogue on ways to move forward in order to reduce the rate of death.
Yeah, but Niola, because the question here is the misconceptions. There's this notion that there are a lot of misconceptions about the disease. What are some of these prevailing ones out there in Nigeria?
Okay, can I comment?
Yes, yes, please.
Okay, the misconception there is that Nigeria is a country who is very religious, and we have some beliefs. Nigeria is a country that there's some culture, and we are a very religious country, and this is affecting the misconception on cancer. And we as an NGO, we've encouraged and we've realized that the major problem we have in this country is that we want the religious body to partner with us in creating awareness on cancer. Because most people in Nigeria will listen to their pastors, their imam, rather than listen to their doctors or listen to we advocates. And so how do we want to reduce the cancer death rate? If you can see the sign coming up and you run to your doctor, fine, some of them, when they even go to the hospital, they don't even listen to their doctor's advice. They'll rather listen to their spiritual father.
So you're saying religion plays a big role.
Yes, a big problem.
And I want to segue it into your own story, personal experience. I mean, so sorry, my condolences, you know, on the passing of your husband to cancer. What was your story like? And what is your story like? And what would you say, you know, were the things that gave you strength while you were going through this?
Yes, yeah.
And the things a lot of people can learn from your husband's story. Just share a little bit of
Thank you so much. My story as one of the widows that lost their husband to cancer is very different and peculiar. And since I have the opportunity to share it, I'm going to share it again. I got married to one of the fantastic guys in my class in my university days from University of Lagos. And this guy is very religious. Yes, he goes to church. He was even more religious than I, very forgiving, very loving. And lo and below, they were treating him for malaria. So we thought he had malaria. And we started treating him. Then after 1 month or so, a few weeks, we were told that there is something in his blood. And that is the problem we are talking about, misdiagnosis. Every problem, most problem in Nigeria, some of our doctors will first treat malaria and typhoid. And you say, what is wrong with you? I have malaria and typhoid. No, please, get the right diagnosis. Do the right thing. So my late husband was doing, and after a while, we were told after so many investigations, further diagnosis, and they discovered he had cancer. And that broke us down because we went through some life-changing experience as partner in our marriage, as having issue with childbearing and all that. And he was very kind. He's a wonderful guy. He never used it against me, even as his wife, which we know the Nigerian setting, when a woman is not conceived or doesn't have a child. Though I had a child and I lost the child in 2011 on Valentine's Day. That was 2011. Then on 2000, we are getting out of that trauma and malaria turned to cancer. And I've never heard of colorectal cancer. And we were told I had colorectal cancer. Then the most shocking news was that he's going to take chemo every 10 days because his cancer is radical. And the chemo is going to cost us about 360,000. And we're like, what? What is wrong with him? And I thought chemo is even normal drugs. I never know what I'm going to expect, though they told us, but the reality never set in. Nothing. I saw my husband be changing, a very handsome man. His skin changed, the hair fall off, the nails start coming up and all that. And then after 6 courses or 7 courses of the chemotherapy, and we're happy that we are done. And I saw him getting back on his feet. And the next thing, he became healed again. What happened? They said the cancer is back. Wow. So what do? I gave up on Nigerian medical system. And I insisted that I'm taking my husband to India. And most of our doctors there was not able to look me in the face and tell me that your husband is going to die. So I took him to India. Then the church stepped in. My church stepped in, Fountain of Life. They stepped in, my pastor, Pastor Taiwo Dukoya, Taiwo was stepped in. And they took up the bill. Then his uncle too. They all came together. My late husband's uncle, we sponsored, we took him to India. And when we got to India, what we don't do in this country, the doctor started telling me, see, this is a late case. This man will die. He has 3 weeks to die. And I lost it because I was a Christian. Our beliefs and culture in this country, we don't talk about death. You don't tell people they are going to die. But now I realize and I know better that I think it is better for you to tell a cancer patient if they are going to die, you are going to die. Yes, because it will save you so many things. Instead of them raising money and then they'll be able to prepare themselves, they will be able to put closure into many things, they will be able to do a lot of things, they will need to settle so many things. There won't be hope. You won't give them on false hope. Nobody was able to tell me in this country that my husband is going to die, but they only look at me with pity. It was later I knew that even some of the doctors knew he's going to die, but they didn't tell me he's going to die. But when I got to India, they were telling me he has 3 more weeks to live, he has 2 more weeks to live, he has 5 seconds more to live. And yes, when it was 5 seconds, Bola breathed his last death. And they asked me to witness it. Because when they were telling me that he's going to die, 2 weeks, I tell you, I didn't believe them. Instead, I'll speak in tongue. I'll use the Bible verses to reply them.
Say God forbid.
God forbid. He's a covenant child of God. And the promises for his life is he will not die but live to see his children's children. I quote the Bible verses to verses. And thank God I was a grounded Christian because his doctor in India is not a Christian. And I don't know what they are, but he told me, said, there's no God. Anytime I tell you about your husband diagnosis, you're always shouting, God, God, God. I'm not God. I can't do miracle on your husband. Your husband is going to die. I'm not the one that gave him cancer.
Let me come in here, and I really am sorry for your loss and what you've had to go through. And from this, from the story you have just narrated to us, you've spoken about the high cost of medical treatments. I want to ask you 2 questions. We're going to go on a break real soon, and you probably answer when we come back. However, the first question I want to ask is the culture, especially in Nigeria, where people are misdiagnosed or not necessarily understand the ailments that they are going through, but then they are still charged for tests like malaria tests, typhoid tests. I personally have gone through that experience where I stayed in the hospital for 3 days for something that I could have been treated on right there and there, but they wanted that, staying in the hospital, paying for extra service and staying there. Now, that's one. Then secondly, in a country like Nigeria, where we are experiencing higher numbers of cancer cases, and we know that the cost is high. How can the federal government step in, or what policies can be put in place to subsidize that money that is being spent? I mean, we know that we have 100 million people that are currently living below $1 a day. How can they pay for such, for such treatment? Can you just start on that and we'll call for that break soon?
That's interesting. For me, if we wait for the government, nothing will be done. All over the world, globally, cancer control and cancer management is not left alone for the government. I tell you, that's the honest truth. But it's so sad and unfortunate that Nigerians don't donate into cancer causes. Honestly, that's the honest truth. One of us, a known advocate in this country, Ronsi, wrote something, and I read it a few days ago, that if we leave donation to foreigners, foreigners are not dying. It's Nigerians that are dying of cancer. If we wait for the government, things won't be done. So we all have a duty. You here, you are media, and you are taking the story out there. So all over the world, the government will make policies. Yes, the government has their own, and I won't lie to you, we are working on it, and we are holding the government accountable. They've not done enough. I said they are waking up, but they've not done enough.
We're going on that break now. When we come back, we'll continue this conversation. Stay with us. Welcome back to the morning show. We're still joined by Eniola Akintunde, founder and executive director, Niola Care Foundation, as well as Olatunji Ola-Davies, who is the program coordinator. And before the break, you were going to land on the point. We're talking about the misdiagnosis, as well as the fact that policies put in place by the government because of the high cost of treating cancer.
Yes, as I've said, that cancer control and cancer management cannot be left alone in the with government. If you keep talking about government is not doing this, government is not doing that, we have so many billionaires in this country now. Honestly, that's the honest truth. Then we need to do more. We all need to join hands and do more. Then on the misdiagnosis that I mentioned, I give it to our doctors. We have most of the brilliant doctors in this country. Yes, our doctors are good, but most of them does not even have equipment to work with. How many cancer centers do we have? How many screening centers do we have? Then their workload. How can one doctor, a consultant, we see 60 or 70 patients a day? And you want them to function very well. You want them to diagnose very well. Let's look at all these things. Our primary healthcare centers, they are not functioning. So most people run to general hospitals, go to LUTH, go to LASUT, go to national hospitals. How long are we going to do that? The primary healthcare center needs to be sustained, needs to be equipped, needs to be set up, and take doctors there. So they will be the first port of call for any constituency or community, this core community.
Mr. Eniola Akintunde, let me bring you back to this conversation, because when you speak to survivors of cancer, they will tell you that cancer is dreadful and expensive. How can we get creative with funding treatment of cancers for people? We know this challenge is huge, it's enormous on anybody. It takes a toll on the family, on the society, and even on the public health facilities we're talking about. How do we get creative with funding cancer?
Well, the social economic implication of not properly investing, in cancer treatment is very huge and very high. And like you said, the challenge has been the scarcity of fund, to be channeled into a healthcare facility. If we're talking about diagnosis, most importantly, we understand that if there is wrong diagnosis, there will be wrong prognosis. And at the same time, you understand, prevention is better than cure.
And cheaper in the case of cancer.
Exactly. And, little things count in this thing that we're talking about, because we're talking about creative funding.
Yes.
Because it has to limit the amount of resources that be channeled into, government priorities are different. They are competing with a lot of things, If you look at the budget on health, compared to infrastructure and defense, there is very low. And the truth of the matter is that not terrorism, not accident, has the rate of death like cancer. So cancer as a non-communicable disease has higher rate of death than terrorism that is happening at the north and east part of Nigeria, than the number of accidents, being put together. So what we're saying is that in terms of creative funding, government needs to look inward. Let me give you an example. Like government has directed that some percentage of funds should be, invested into some key sector of the economy. The government can also mandate related, organizations.
Do you think we should add this to our national health insurance scheme? Because I do know that cancer is not on that list. Should we put cancer on that list?
Exactly.
Yes.
Let me also say this. The Nigerian National Cancer Control policy, there was the strategic plan that is meant, that has been put for 2018 to 2020. Fantastic policies. It has taken care of what you have just suggested. When you have good policies, if you look at the document, is voluminous, but if you look at the document, up to today, the challenge is implementation. It's implementation. Fantastic policies, fantastic.
Okay. I just quickly want to come in here. So there is a need for cancer centers, screening centers. And I'll give you an instance. I was in Louth at some point. Goodness me, I think it was only one machine that was working that day. And there was a lot of people, because I had done some work with the Cervical Cancer Foundation, CS done. And we saw the fact that there was a dearth in these cancer centers, non-availability of these cancer centers. How can we even start up with mobile cancer centers?
Okay.
So how can we start raising funding for that in providing solution? Mobile cancer testing centers. Okay. The quick ones available.
Okay. Right now, when was this visit to Louth? When did you?
Like 3 years ago.
Oh, now Louth has one of the fantastic world-class cancer centers right now.
How many machines do they have now that is working?
It's working about
President
5 or so.
Commission,
about 5 or so machines are working.
Okay.
Yes, you need to pay a visit. Fantastic job.
So
I must commend it.
So how can this replicate this?
But how can they replicate it then? How can the middle class access it is the issue right now?
So it's still expensive?
It is very expensive. That's the honest truth.
How much is it give or take if you have to have
we had a patient that went there that has
radiation?
Yeah.
Radiation,
no, I'm telling you, it's world class. It's world class. And we have a patient we sent there, and I think it's going to take about 10 chemo, and one is about 750,000.
That's huge.
Well,
and
so
the kind of funding, and this is a guy that is just a security. He's even a security guy. So how is he going to do that?
Very quickly, because I know we're almost out of time here. On a day like this, you're about awareness, and you get people to come and screen at certain points. But beyond that, what are we doing today? Or this month, which is the month of awareness. What are we doing? To be specific.
To be specific, I must, if I shout out to all our cancer advocacy in Nigeria, we are awesome. We did a great job. On our group, it was amazing all over the country. Despite the fact these people doesn't get, the organization, cancer organizations are not getting funding. And I'm saying it. We normally have one of the biggest events in this country, Ijoya, because Nigerians love dancing, and we thought, how can we create awareness? Because, as I've said, our beliefs is affecting us. Nigerians don't want to listen to cancer advocacy. They will tell you, it is not my portion. And we've asked them, whose portion is cancer? My late husband was a Christian and he had cancer. Does it mean God doesn't love him? No. So we created all these events to go. And if you look at the media of recent, in the last few days, you see so many NGOs creating awareness, doing work, doing all sorts to create awareness, even with limited fund. So we've been doing that. On Saturday, there was a walk, and we've been on TV. People have been on radio. We've telling people, you need to get yourself checked out. When you listen to your pastor, please listen to your doctor. Listen to We Advocate. Listen to the cancer message. What Nigerians are not doing, what the global world are doing, let us do it. Cancer is a global challenge, no doubt. But what are they doing in other countries? Nigeria will prefer to buy Ashwebi than to take care of a sick person than to contribute. They will go, if you post a picture of someone that needs funding, you will see underneath, it is well, though, God will provide, though, they will run. Even 1,000 out of job. We need to imbibe the culture of giving. This is our country. In fact, we can tax ourselves. We are going to buy the cancer centers.
What do you give in a country where close to 100 million people are living in abject poverty? How do you give?
Okay, you give information, education.
Okay.
Early screening.
Early detection.
It saves life.
Early detection.
When you educate people about their lifestyle, they need to live healthy. They need to eat organic food. We need to decentralize our mind from all this junk food. And, you know, the lifestyle you live detail the kind of things that is going to happen to you.
Okay.
So information is very vital. Education is very vital.
I'd like to come in here very quickly because we're going to be wrapping up soon. Let's talk about alternative cancer treatments, because there have been isolated cases of people that had severe cancer cases and went on this alternative treatment and got better. And even in 2017, there was a milestone achievement in treatment of cancer alternative called helixotherapy that found its way to his country. What's happening with that?
Yes, honestly, I buy into alternative cancer treatment. Honestly, though we need to go into research. That is why we still need funding. Because I believe if I can use bitter leaf when I'm having some health issue, after doing my normal treatment, I've seen a doctor, I saw a gynecologist, he said do this, and I did it. Use this, I use all what they asked me to do. I'm not going to do self-examination. But other things, what do I do? Bitter leaves is being bottled in US now in capsule. So for them to start using bitter leaf, there are some other things we can use.
So you're saying research?
Yes.
Research.
And then again, I want to thank the federal government for the closure on our border, because I, as the person, have been shouting at top of my voice that our border must be shut. Nigeria is like a dumping ground. They are dumping all sorts. And for the high rate of cancer, cancer has been linked to what we are eating. So what are we eating? What are they feeding us with? So alternative treatment for cancer, it's a well-called development. Let's look into it. Let's start on it.
So let me add to that. Currently, cancer has no cure. Yes. You can only prevent it.
Exactly.
So your lifestyle, in terms of what you eat,
is very important.
And that's a very good place to end this conversation. The message out there is go out for screening. Your lifestyle is important. Funding and research. I think that's a consensus here this morning. Thank you so much for coming on the show today. And that brings us to the end of the show. I am Adesua Omorwan.
Rufai Oseni.
And I'm Shaiton Atigari. Thank you for watching. You can also follow us on all our social media handles showing now on the screen with live streaming on arise.tv.